My name is Daniel Fleming, and today I'll be presenting a Micah Plus Hospital handover using the acronyms DMIS and RCPR. The date is the 21st of May 2014. Firstly, I'll be doing the hospital handover. So, the patient is a 55-year-old male who lives independently from Seaford. The patient experienced a syncope of which he had little memory, fell to the ground, leaving him with pain and a hematoma to the back of his skull and pain in the left arm. The patient is presented with nausea, dull pain in the left arm with no radiation, as well as a hematoma. He rates his overall pain a 5 out of 10, and he's allergic to morphine. Upon loading at 2:15, the physical examination demonstrates the following: heart rate of 80, regular, blood pressure 130 over 80, rest rate 18, chest was clear with left equaling right, no adventitious sounds and air entering the bases, GCS 15, temperature 36.4, O2 sat 98 and blood glucose 6.2. Patient was cannulated at the right Q fossa and given 25 micrograms of fentanyl via the IV route with a 5 ml saline flush before and after. This reduced the pain from the original 5 down to 1. Patient also was treated with nasal prong O2, which raised his O2 sats from 93 to 98. Expected time of arrival is 5 minutes. I'll now do the Micah handover. Hi, my name's Dan from Seaford, the crew, and today we have Michael, who is a 55-year-old male who lives independently at home. Michael had an episode of syncope roughly 10 minutes prior to our arrival. He woke concerned and confused with a constant dull pain in his left arm with nil radiation. He was also struggling with nausea. Michael, after physical examination, heart rate was 80, 130 on 80 blood pressure, skin was warm, pink and dry, GCS 15, rest rate 16, nil effort, short and shallow breaths, clear chest with left equaling right and good air entry to the bases, calm in nature. Temperature was 36.4, blood glucose 6.2, OSATs now 98. After completing head-to-toe examination, a hematoma was discovered behind the skull. Background: the patient suffers from type 2 diabetes, hypertension, hyperlipidemia, hypocholesterolemia, ETOH abuse, and has been heavy smoking for 40 years. He has a family history of ischemic heart disease, however had no issue thus far. His medications are Anticant, Lipitor and Divez. However, Michael has admitted to not taking his medication for several days and is allergic to morphine. We believe that this episode has been brought about due to Michael lapsing with his medication. However, there may be an underlying cardiovascular disease. We treated him with nasal prong oxygen due to his low O2 sats. We also cannulated the right Q fossa so we could administer 25 micrograms IV fentanyl, as well as 5 ml saline flushes before and after. This reduced his pain from an original 5 to 1. The reason we brought Michael into the hospital today is that we were concerned that he may further need assessment. As well as his rest rate was concerningly high, he has also not taken his meds. There may be underlying issues and further examination of it is recommended.